Dr. Brian McDonough will help you decide whether that's the best method of feeding your baby. Brian?
Lee, in the last 5 years, there have been advances in formulas for infants. Many of them provide all the necessary nutrients for growth, but they are all copying the best formula, nature's own.
And we lived away, so we didn't have any family members.
There's little doubt that breastfeeding is the best way to feed your baby. Certainly, it's invaluable for the relationship between mother and baby. It forces them to bond. But there are other health reasons as well.
There are other very important things, too, such as the transference of maternal antibody against disease to the baby through the breast milk. So babies are more resistant to developing disease such as gastroenteritis and possibly also some respiratory diseases as well.
The baby is also protected from allergies that can be related to cow's milk and soy formula. That can become a problem later in life. The first 2 weeks of breastfeeding is the most difficult part. A flow of breast milk needs to be established. The mother needs to nurse often and regularly.
We know that babies need to nurse more frequently than their bottle-fed counterparts, so we know that's how we build up our milk supply.
Breastfeeding can be very convenient. Stephanie has twins.
In the middle of the night, I don't have to be up with two babies crying. Usually one will wake up and then the other one will wake up. So I'll bring Christina in bed with me and I'll lay down and I'll just fall back asleep. And then when Jennifer wakes up, I'll switch babies.
To do bottles is mind-boggling to me. You know, the people that do it are amazing, that you can get up in the middle of the night and trudge downstairs and everything. For me, I'm just like, it's so much easier to just pick her up and just get in bed and, you know, sit there and nurse her for a little while and then she goes back to sleep.
But there's some other reasons, too. For one thing, it's more economical. It's not free. You still have to buy some extra groceries and eat them so that your body can make the milk. But it is more economical than buying formula, and it's more convenient, too.
With all these advantages, why would a woman choose bottle feeding? Well, there are a number of reasons. One is that when women go back to work, they don't want to breastfeed. It's impractical.
For example, a mother may have nipples that are inverted. That is, they turn in, and it's hard for the baby to get a hold of them. The nipples may get cracked and bloody, and it may be very difficult to clear that. And that can be quite painful.
It's also possible that the breast will not make enough milk, or the mother may have an illness that makes breastfeeding not advisable. For those that bottle feed, there are excellent products on the market that do a very good job of simulating breast milk.
The formula that's most often used is a cow's milk-based formula. Most babies will tolerate that without too much difficulty. There is also soy-based formula for an infant who may not tolerate the cow's milk protein in the other formulas.
Most infant formulas come in two basic forms. One type is a concentrate in which you add sterile water. Another is a powder.
She always used to complain about at nighttime how she used to get up at the bottles and the baby went...
The argument is this. For those who support breastfeeding, pumping the breast can replace the convenience of a bottle.
Oh, really? So, yeah, so it's kind of like...
The pump allows milk to be saved and given to the baby at a later time. Many women have problems using the pump. There are some ways to make it easier.
You might want to pump on one breast while you're nursing the baby on the other breast to take advantage of the natural letdown. This particular type of pump does all of the work for you. It's an in and out action just like the baby's nursing.
Ultimately, the decision comes down to a personal one between mother and baby.
I really went in with the attitude, well, we'll give it a try. If it works, it works. If it doesn't, it doesn't. I mean, there's always bottles, there's always formula. It's not like, you know, I can't run to the store and do that kind of thing. Just call the pediatrician and ask what to start with.
Now, Brian, is it possible for a mother to do sort of a combination where they do both the breastfeeding and the bottle feeding at the same time?
That's becoming more and more common. Actually, what's happening is mothers are what they're doing initially is they're taking the breastfeeding, they're building it up over time. After about 2 or 3 months, maybe they want to go back to work, they want to start back in with a job again. If they don't do well with the breast pump, and that can occur, it isn't that easy of a thing to do, there's a lot of work with it. They sometimes will breastfeed when they're home and then bottle feed at other times. Although the baby gets used to having the bottle and doesn't want to work as hard for the breastfeeding, that's one of the problems with it. Babies are kind of lazy, they want things handed to them, but they'll kind of take their time.
It's an interesting series. What can we look forward to tomorrow?
Tomorrow night actually is a very, very important topic. We're going to talk about immunizations. And in light of what's happening in Philadelphia right now with measles, the importance of immunizations really can't be stressed enough. We're not just going to talk about measles, though. We're going to talk about the whole gamut. And we're going to talk about when they should be done, what you can look for with your children, and as time goes by, what's going to be happening. There'll be an actual schedule for you to take down, so have your pencil